Welcome to the clinical podcast series brought to you by the American Academy of Optometry Foundation. The topic for this episode is effective blue light filtering intraocular lenses on age-related macular degeneration, a nationwide cohort study with 10-year follow-up. It is my pleasure to thank our host today, Gretchyn Bailey, our topical editor, Dr. Andrew Rixon, and our topical expert, Dr. Jessica Haynes. And now it's my pleasure to begin today's podcast.
Hi, everyone. I am Gretchyn Bailey, and I am a fellow of the American Academy of Optometry. And today I am joined by Dr. Jessica Haynes, who is also a fellow of the Academy. In addition, she is consulting faculty at Southern College of Optometry, as well as part of the Charles Retina Institute in Memphis. Jessica, thank you so much for talking with me today.
Thank you, Gretchen.
Well, today we are going to talk about a study that was published very recently in the February 2022 issue of the American Journal of Ophthalmology. And this is the effect of blue light filtering intraocular lenses on age-related macular degeneration, a nationwide cohort study with 10-year follow-up. And that was conducted by Lee and colleagues. So the purpose of this study was to determine incidence rate of AMD after cataract surgery and to take a look at the effect of blue light filtering blue light filtering IOLs on the incidence of AMD. And this study, wow, it was big. It had about 186,000 patients. That is a lot. And so, Jessica, can you tell me, how does AMD affect cataract surgery for patients?
So, for the longest time, there was this fear that cataract surgery could induce macular degeneration, or macular degeneration could worsen following cataract surgery because you're removing the natural lens of the eye, which has UV blocking potential, and either, especially a long time ago, leaving the patient aphakic or implanting an intraocular lens. It is now accepted cataract surgery for our patients with macular degeneration, or even those who are at risk for macular degeneration, is safe. I would suggest the most important aspect of this is to get a careful retina exam and do an OCT prior to cataract surgery, so that if AMD is there, you can find it and educate your patient about potential, not complications, but the fact that their vision may not be perfect after cataract surgery since they have macular degeneration.
Got it. Well, how does blue light affect AMD?
So blue light, there's so much talk now about blue light, short wavelength light, and especially the fact that we are getting this light from sources such as our tablets, our iPhones, our computer screens, etc. And does this accelerate macular degeneration, or potentially take a patient who would not have gotten macular degeneration and push them over the limit to develop that? But whether or not this environmental blue light that we have truly does that is somewhat controversial.
Well, if we take blue light together with IOLs, what do ODs need to know about blue light filtering IOLs?
So per this study, and as you said, this was 180,000 patients, which I think is really important. And this was also over the course of 10 years. So when you're talking about something to see whether or not a pill, a blue light filter, etc., causes or doesn't cause or prevents AMD, you have to have a lot of patients and you have to follow them over a very long time, because it takes time to develop this, which is essentially what this study did. And they found that there was no benefit of the blue light filtering in preventing macular degeneration in these patients. So the two cohorts, those who had blue filtering IOLs versus those who did not, developed both dry and wet macular degeneration at the same rates.
Interesting. So what should ODs take away from the results of this study?
So we do make recommendations for patients for cataract surgery, lens implants for cataract surgery. And there's so many factors in that as far as the patient's hobbies, activities, refractive error, even their personality. So it may be something where whether or not the lens contains blue light filtering properties may be less of an importance than some of those other factors. And I do think you can somewhat potentially extrapolate this to blue light filtering glasses, which is something that we also recommend for patients. But again, their situation in which you might recommend that for a 30-year-old patient who does a lot of computer work is technically a different patient population than this older population who is having cataract surgery, but just something to keep in mind.
Good information. Thanks very much for talking with me about this today.
Thank you.
And a special thanks to CooperVision for their educational grant to make it all happen.